Welcome to SLP Nerdcast, the #1 professional resource for evidence-based practice in speech-language pathology. I'm Kate Granbois.
And I'm Amy Wonka. We are both speech-language pathologists working in the field and co-founders of SLP Nerdcast.
Each episode of this podcast is a course offered for ASHA CEUs. Our podcast audio courses are here to help you level up your knowledge and earn those professional development hours that you need. This course, plus the corresponding short post-test, is equal to 1 certificate of attendance. To earn CEUs today and take the post-test after this session, follow the link provided in the show notes or head to slpnerdcast.com.
Before we get started, one quick disclaimer. Our courses are not meant to replace clinical advice. We do not endorse products, procedures, or other services mentioned by our guests unless otherwise specified.
We hope you enjoy the course.
Are you an SLP or related professional? The SLP Nerdcast Unlimited subscription gives members access to over 100 courses offered for ASHA CEUs and certificates of attendance. With SLP Nerdcast membership, you can earn unlimited CEUs all year at any time. SLP Nerdcast courses are unique, evidence-based, with a focus on information that is useful. When you join SLP Nerdcast as a member, you'll have access to the best online platform for continuing education in speech and language pathology. Join as a member today and save 10% using code NERDCASTER10. The link for membership is in the show notes.
Welcome, everyone, to today's episode. During this episode, we had the great pleasure of welcoming Christy O'Donovan onto our podcast. Christy is a fellow speech and language pathologist. She is also a traumatic brain injury survivor. We really feel strongly that as speech and language pathologists, as part of our professional education and professional development, we need to continually be listening to and learning from the experiences of others. And in focusing on those experiences and listening to those stories, we can refocus our clinical lens and continue to incorporate aspects of person-centered care, patient-centered care, and one of the 3 triads of our evidence-based practice triangle, which is client perspectives and values. We hope that you enjoy this story that Christy is here to share with us and continue to reflect on your own clinical work and how you are supporting and centering the values and needs of our patients and clients. We are so grateful to have had Christy as part of the show, and we hope you enjoy. Welcome, everyone, to this week's episode. We are so excited to welcome today's guest, Christy O'Donovan. Welcome, Christy.
Thank you.
Christy, you are here to discuss life after a craniotomy, supporting patients and families in the healing process. So before we get started, can you please tell us a little bit about yourself?
Sure. My name's Christy O'Donovan. I am a speech pathologist. I own my own private practice, Leading Therapy Home on the South Shore of Massachusetts. I'm a mom of 2 little kids, live a crazy busy lifestyle, and I have had a brain injury through craniotomy.
We've only heard right before, as we were preparing for this episode, you got halfway through telling us your story, and then I said, "This is too good. It's too good. You have to wait." So I'm on the edge of my seat now, wanting to hear more from you and giving you an opportunity to tell us your story. But before we do that, I have to read our learning objectives and our financial and non-financial disclosures because ASHA makes me do it. So I will get through those quickly, and then we can hear more about what brought you here. Learning objective number 1, describe at least 2 aspects of the physical, psychological, or emotional healing process following a brain injury. Learning objective number 2, identify at least 2 ways in which a brain injury can impact return to work, school, or integrating into the community. And learning objective number 3, indicate at least 2 non-clinical ways to support patients and their families following a brain injury. Disclosures, Christy O'Donovan's financial disclosures. Christy is the owner of a private practice, Leading Therapy Home. Christy received an honorarium for participating in this course. Christy O'Donovan, non-financial disclosures. Christy has no non-financial relationships to disclose. Kate, that's me, financial disclosures. I am the owner and founder of Grand Bois Therapy and Consulting LLC and co-founder of SLP Nerdcast. My non-financial disclosures: I am a member of ASHA SIG 12 and serve on the AAC Advisory Group for Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy and the Association for Behavior Analysis International and their corresponding speech pathology and applied behavior analysis special interest group.
All right, Amy, my financial disclosures. I am an employee of a public school system and co-founder of SLP Nerdcast. And my non-financial disclosures are that I am a member of ASHA, member of SIG 12, and I serve on the AAC Advisory Group for Massachusetts Advocates for Children. All right, on to the good stuff. Christy, why don't you start off by telling us your craniotomy story?
I'm on the edge of my seat.
I know.
I can't wait to hear it. Go for it.
It's a really interesting one. So my senior year of college, studying to be a speech pathologist, on the way to an internship, and I was in a car accident. Minor whiplash, hit from behind. I had some neck pain, went for a scan. After a while, not getting better. And I was sat down and told, you have a brain injury. You have what's called a Chiari malformation. I probably have had it my whole life. They said, no bungee jumping, no skydiving, all things I've already done. And they said, just know you have it. And then I moved off to Thailand, actually, in between college and graduate school, got some extra massages for my neck pain, went about my life. So
can you define what that is? Can you tell us what that is?
Chiari malformation.
A Chiari malformation. I couldn't say it back to you. I couldn't remember. That's my graduate school neurology failing me. But if you could tell us what that is.
Yeah, I'll do my best. So from real layman's terms, it's a slight elongation of the tonsils of my cerebellum are slightly elongated beyond. So it's often causes ataxia. And typically you'd see patients with like type 2, type 3 who may need surgery to remediate. Mine was mostly asymptomatic. Could have caused some of my kind of klutziness or I walk into walls sometimes. But really it was just something they said, just keep an eye on this. So this isn't how the craniotomy happened. So kind of fast forward there, I came back, did my CF as a speech pathologist in a busy outpatient center, got my CEUs working, and things were starting to settle down into my life. And I went to my PCP once and said, no one follows me for that brain injury that I have. And she said, oh, I'll send you for some updated scans. And then you can have a relationship with a neurologist up here in Massachusetts, because previously I was in Maryland when I first was diagnosed. And they sent me for some scans. I did it, no problem. Then I get a call after saying, you need to see a neurologist immediately. And they wouldn't tell me why. And she said, there's something widening the arteries of your brain. There's something going on with the arteries of your brain. We need to get you in. So I start calling around, had no idea what's going on. I have a slight understanding of neuroanatomy at this point. It wasn't one of my best college classes in college, but I bring my then fiance. I'm 26, I'm engaged, I'm working a couple jobs, as we all are as new clinicians. I bring my fiance with me and I'm nervous. And the doctor didn't get my scans. She's like, I don't know why you're here. You don't need a follow-up for a Chiari malformation. And she never got my scan. She's like, I have to go. She sends me away. We're at the elevator doors. And she comes, she's like, I need you to come back in my office right away. I got your scans.
Oh.
She sits me down. She says, you have an aneurysm. I need you to see my colleague. I'm going to have my receptionist put you in touch, but I have to go. So that I go back, I get on the T. I'll never forget this. I miss my stop. I have 3 stops. And I get a call an hour later from neurosurgery booking me a consult for the next day or sometime very soon thereafter. So I go to neurosurgery and I have one doctor who says, yep, I'm quite confident this is the treatment for you. It was a minor treatment going up through my groin. And it was going to be scheduled right away. So they can go in, take pictures of the aneurysm, get a better understanding of it, and then treat it.
Okay, so let me just recap this for you. You found an aneurysm by accident after an unfortunate experience where there was a massive pump fake where the neurologist was like, go home. Wait, just kidding. You're in my hallway also you're going to be booked in neurosurgery in an hour. That must have been a very intense period of time. You mentioned that you missed several stops on the T. I can only imagine what must have been going through your mind at that point in time. So you go to, I assume you get booked with a neurologist next for neurosurgery. And what did they say? Were they helpful?
He said, "You're lucky you found this when you did. We need to take care of this right away because you're at significant risk of an aneurysm rupture." He said, "I know I'm going to book you for something." I think it was 2 weeks out, where they go in through my groin, take a picture of the aneurysm to get a better view of it so that they could see it. And then he wanted, I don't know, was it another week later or 2 weeks beyond that, to go in and treat it through, again, through the groin, to go up, fill it up with coils. And he said to me, "You're young, you're a pretty girl. The other option is a craniotomy, and there's much more significant risks, and you're going to be disfigured." And then he said, "So I need you to stay calm. Don't lift anything over 10 pounds. And let's take care of this right away for you. So this is behind you." And I went
I
back
just
and I
want
was,
to pause for a second and reflect on the insane advice to stay calm. I understand the neurology and biology behind that recommendation, but that seems
Impossible. It seems
must have been
impossible.
very difficult for
I
you.
feel like that is a lot of stress happening.
Mhm. I remember we stepped out and I was with my fiance at the time, and I burst into tears, and he was so panicked because all of a sudden he was worried that I was going to have a stroke right there in the cafeteria
Because you
of
were crying.
the hospital. Yeah, just from the stress. And we were in the process of moving, and it suddenly became a, don't lift a box, don't bend. We're worried that we have no idea, because that was the impression that the first doctor had given us.
So you, I assume by the way you're telling the story, when you're saying the first doctor, something about that experience motivated you to find a second opinion.
I was sitting around the lunch table. Fortunately, as a therapist, I was surrounded by very smart therapists who were much more seasoned than I was. And one of my friends at the time said, "You'll have to get a second opinion." Yep, I guess I should do that quickly. So I booked myself with another local doctor. We did some research and found someone really good, because at first it was just I didn't even realize I had to be seen by neurosurgery. This was all happening so fast. So I booked myself a follow-up or a second opinion. And the next doctor said, "I can see this aneurysm just fine. I don't need pictures for it." And no, what the first doctor didn't tell you was that we've only been coiling aneurysms at the time for 9 years. We don't have a lot of research, and we don't have very little research on your particular aneurysm and the way it was shaped. He said, "Craniotomy. You're the ideal candidate for a craniotomy. We'll go in, you'll be fine. 4 weeks, you'll be back to work."
All right. That's a very different message.
Wow.
And he said, "You could live with this indefinitely. We don't know. And we can book this out 6 months if you want."
So I'm reframing this and thinking about it from your experience, but also in terms of how you advocate for what to do next, in terms of the trust that you feel with the medical team that is treating you. That's a really big difference.
It was huge. It was really frightening. Could be what felt like a life or death decision. Do I go with one that was just this minor quick fix? But then this other doctor was telling me, "You actually can't trust that this will be around, that there's enough research on this, or that this will be a long-term fix. Or do I go for the long-term fix once and for all that had a lot of risk?" I went into a surgery, a really scary big surgery, but it would be taken care of once and for all. There might be risks associated with it. I was told disfigurement, I was told brain injury, but then the second doctor said, "No, you're fine. You're young, you're healthy, you're educated, you're the perfect candidate. Go with this." And to them, it's just, he's a neurosurgeon. It's just another day, right? And to me, I had to make this huge decision and figure out which one to trust.
How do you even begin to sort through something like that?
Well, you're not allowed to cry.
And-
We've
and
established
Right,
that.
you're not allowed to
And
cry.
fast.
You're not allowed to feel anxious. Bend, lift anything.
Oh my
Yeah.
goodness. Okay, so what happened?
So ultimately decided to take the risk and fix it once and for all. The thought of, at the time I was 26, 9 years, not knowing what could happen in 9 years, this colleague said to me, you could still be having babies in 9 years. Could you be delivering, and could your aneurysm, could the coils dislodge? Or, it felt like there wasn't enough research on it for me to make that decision. So I decided to go with the craniotomy, and I was told, you'll be back to work for 4 to 6 weeks. You'll be back. Good as new. So
Science is amazing and wild, but continue.
So I booked my surgery with that second doctor who wanted to do the craniotomy. And I took a temporary leave from my job at the very busy outpatient center. I went through the surgery. My recovery, I honestly don't remember a lot from right before the surgery and right after. My memory loss around that time is really significant. I was barely sleeping. My sleep was really impacted. I had a lot of trouble with my emotions. I had a lot of trouble with noise. My sound sensitivity was really significant. I was not at all prepared for that. If we were out to eat, I remember trying to go out to eat a lot because I wanted to feel normal. And if there was any kind of noise, I would be really disturbed by it. If a sudden noise happened, like my whole body would go into sweats. Decision making became like impossible. Just multi-step directions became really hard. I remember trying to cook a meal. I remember trying to watch television show. There was this intense show that we tried to. Do you ever watch Breaking Bad? We tried to watch that after I was recovering from my surgery.
But I couldn't watch it because it was too intense.
I couldn't handle anything. Oh, it was really difficult. So I was just going through. I guess I should have mentioned right in the afterwards. I did ask if I needed to be evaluated by a speech pathologist. Did I need someone to evaluate me? And I think I had a quick screen in the hospital in the neuro ICU. And they decided no further evaluations were necessary, and I was discharged. So that's what led me to this point. But I got home, and in my early days of recovery, I reached out to my friends from graduate school, speech pathologists, and I asked them to come over and test me. And they found some tests from wherever they were working at the time, and they came over and did a screen, and none of them had specialized in this. So I had another friend who worked at Spalding, and I asked her if she would do an evaluation. And I remember going in, and she kind of tried to put together an assessment for me at the time. But really no one felt like intervention was warranted. Nobody felt like I needed therapy. It was just kind of, you need time. So I took a little time, about a month, and I tried to go back to work. I was told, go back part-time for 1 week, and then you can ramp up to full the following. So I told my supervisor at the time that's what I was going to do. And she was a seasoned SLP with a lot of experience in brain injury. And she was the only person in my life who was like, sure. She's like, you try this. So I went back to my busy outpatient, and I went to work, and I tried to treat a couple patients. And I had a symptom that I could have never understood before having this surgery. And now speaking about it, it's like clear as day. It's called brain fog, cognitive fatigue. And I thought that meant you're tired. And it's not you're tired, it's that your brain, to me, felt incapable of function, of like intentional function. I would just stare off into space, and I would be incapacitated. I couldn't formulate my thoughts. I couldn't explain myself. I would just cry. And the harder I tried to work, the harder I tried to get back in, the more the cog fatigue would hit. I would just glaze over, but like still try to perform my functions, right? I felt like I should be able to. And most people wouldn't notice. It was just my husband who had noticed, then my fiance, or a couple of my colleagues who had known me before the surgery and met me after. So I would try to go into my office and turn the lights off and try to have brain rest whatever that meant. But all the while, it just kept getting harder and harder as I tried to push myself.
And this is after you've been screened and you've been told everything's fine. You're good to go.
Yeah, you can go back to work.
Yeah.
I remember going back to the neurosurgeon. He was like, "You look great. You're fine."
Oh, and I also am just imagining the emotional burden that you're experiencing physical brain fog. I mean, I say physical because it's not a manifestation of something. It's an actual brain fatigue. You're experiencing a physical symptom, but you're in an indirect way sort of expected to just go back to life and there must have been a huge toll that took in terms of, I don't know, feeling not just from feeling tired, but feeling like you said it earlier, you should be able to do these things. You should go back to work, but not being able at the capacity that you were before. Was that hard? I'm imagining that for myself as being a really psychologically and emotionally difficult period.
It was. We're as therapists, we're trained to identify and treat, and we all know you can't turn that off. And then all of a sudden you're looking at yourself and you realize, I'm not right. But I looked okay, right? The swelling went down, and I was treating patients who had brain injuries, pediatric patients who had brain injuries, and here I am still very much recovering from my own. But I think because I was so self-aware and I was able to self-advocate, it almost maybe made the therapists who evaluated me or the doctors look at me differently, and they felt it wasn't necessary. So it was these subtle deficits that really took a toll emotionally that I was aware of, that I couldn't quite get anyone else to acknowledge, and just that I wanted to be done with, to be honest.
Well, and that feels like when you're approaching professionals and advocating for yourself and they're telling you that nothing's wrong. I know one of our learning objectives, I'm jumping ahead a little bit, is around person-centered care, but to me that doesn't sound like it's an example of super person-centered care. When someone is coming to you, when your client is coming to you talking about the challenges that they're facing, and you're like, shush, everything is fine. You're good. I don't know if you had the opportunity to ever experience kind of the opposite of that, where you felt like you went in for an appointment and somebody was more supportive of you, or was that just kind of consistent across the board?
Oh, I think it was more the people that were part of my daily life that some were really starting to notice. Speech pathologists, fortunately, I was around them. My supervisor at the time, or my friends my colleagues, they were starting to really notice, and they were helping me to kind of advocate for what I needed a little bit more and kind of take the time. I think I really needed that permission that, like, you actually do need time to recover from this brain injury. It's not going to be like what you were told.
And you mentioned that you probably had a screening in the ICU, or post craniotomy. And I know you mentioned that you have some memory loss from that time. Do you remember any other supports that you wish you had in terms of setting your expectations? So not just to return to work, but this is a resource you can use if you are feeling frustrated or sad, or you may experience brain fog. Were there any resources to help you transition, I guess is my question.
Oh, you know what? As you're saying this, I wish there were. I really wish there were. I don't know that I was really given many tools besides just, it's going to take time. I remember I was trying to do like Sudokus. I was trying to find apps at the time that I could work on. And what I was told is, really, you're just taxing your brain so much by trying to work, by trying to treat, that you don't need to tax it any further. What you need is rest. But that felt really hard.
In that healing process, I think that's something maybe we can talk a little bit about too, because it sounds like that rest is a really important piece. I don't know if there are other things that you either did or maybe shouldn't do to kind of help facilitate that healing.
Yeah, I think I should have certainly been encouraged to do a little bit more, and maybe it was me not taking the direction, but just I think I was just, for me, I was focused. I was planning a wedding, and I was just focused on getting back to work and bringing an income back. So I just kept going forward, and yeah, I think it just took a lot. I just remember it taking a lot more time than I thought it would.
Do you find that you got most of your support from people who knew you best? You mentioned your husband, you mentioned your coworkers, and I'm imagining, in reframing this through a professional lens for our listeners who may be treating someone with a brain injury for the first time, or, our scope of practice is so wide, maybe they're interested in learning more about treating someone with a brain injury and thinking of these person-centered care components. You as a speech pathologist had this sense to self-advocate and to use the resources that were available to you. I'm wondering about, for those who are not in that position, for the speech pathologists who are listening, how can they help advocate for patients in terms of either setting their expectations or, I don't know, having open conversations about feelings? I mean, even that is something that I think tends to be difficult in an intense clinical setting.
Yeah, but as therapists, so much what we do is really counseling and support. And I think that's where we need to focus more, is really getting to know our patients, truly getting to know them, and not just their scoring on a standardized test, right? Like how their activities of daily living are being affected by this brain injury, despite scoring really well, and how much of a struggle it is, and what their specific needs are and goals and desires. I was pretty in tune, but I'm sure there could have been work that I could have done, or maybe in those early stages. And looking back at it now, 9 years ago, had I done more work, or had I received some sort of additional supports, would I still be facing what I'm facing?
And I want to talk about that too in a bit, but I'm also thinking about this is a soapbox we get on almost every episode for different reasons, but it's so applicable here. And that is that our evidence-based practice model is three-pronged. And one-third of our evidence-based practice model is client perspectives and values. So even if as we frame this through your experience, even if you had been screened, even if you had passed all the tests, and for those who can't see me, I have air quotes going here, right? So you quote, look okay, right? The swelling went down, you look fine. Your experience is evidence. Your experience as a TBI survivor is valid evidence. It is evidence-based practice to consider those variables, and if necessary, design interventions or find supports and resources to help the person as they define their best outcomes, as opposed to, you're within the quote average, you passed it, you scored, you scored within one standard deviation of the mean on the test. That is not always evidence-based practice. And as I'm hearing you talk about these presumably subtle differences that only you and your closest family and friends were able to discuss or identify, it's still evidence. It's still really important.
Well, and it makes me think about the importance of a comprehensive assessment, right? So this is yet another soapbox, I guess, that we get on. But, thinking about when we make all of our decisions, or 90% of our decisions are informed by norm referenced measures, we're missing all of these pieces. We're missing the pieces that would come out, the client perspectives piece that would come out in a comprehensive interview. We're missing, maybe the more subtle deficits that would come out in more informal diagnostic measures. So I think, that's something that I've been reflecting on and hearing your story, Christy, is just, it sounds like a lot of these decisions were sort of driven by more of that, like, well, we did the test, we looked at you, you're good to go. you got the right score, out the door, you know? And that's unfortunate too.
So you mentioned experiencing some brain fog. You mentioned experiencing what I have to assume is psychological or emotional discomfort and in that transition. I'm wondering if you can tell us about how else your TBI impacted your return to life. I mean, across work, across participating in your community. You mentioned you had a wedding around the corner. I mean, those are some really big life events. Can you tell us a little bit about that?
Yeah, so my symptoms were really interesting. Just like I said, working memory, language formulation, a lot of executive functioning, decision making. I don't think that was my strong suit before, for sure, but it certainly was compounded significantly. But I remember I have a few really unique ones, and they're still lasting. Sound sensitivity, but large sudden sounds still to this day. And in places of employment I've had, they'll always let me know before there's a fire drill, because if the fire alarm suddenly goes off, my whole body, I have a whole body reaction. Or if my kids pop one of those Amazon pop, those pillows, those air pillows suddenly, and I'm not expecting it, I get so emotional. Like I could actually cry from it. It's really strange sensation. Like my whole body feels rocked. It's a really strange sensation. Even like, and be still to this day, if I'm trying to have a conversation and I am listening or thinking about something else, I cannot divide. And everyone says, "Oh, that's hard." It's impossible for me. I can't be typing and listening. I'm just, and I think it's just the quick brain processes. Like I really needed a slower pace for a while. So I kept building in more breaks at that outpatient center and hoping that with breaks in between, I would be okay. And unfortunately, I kept ramping up my hours and then decreasing. It took about a full year before I was fully back to work, when I had been told it would be 4 to 6 weeks.
And I think that just goes to show the different definitions that we all have of, and again, I'm using air quotes for people who can't see me, but the different definitions we have of quote wellness, right? So neurologist looking at you, your swelling has gone down, you're outside of the statistically significant window for additional complications after surgery, right? So that's the neurosurgeon's threshold. And thinking of our audience as SLPs who are supporting people in your position, the threshold for what is well or what is wellness is to be determined by the patient, not by us. That is, that is not where we are in a position to be inserting our opinions as we support people who have experienced a TBI. It's making me think of, we did an interview last year with a woman named Jenna Murray Rosenthal, who is a speech pathologist, but also a physical trainer. And a lot of people who, she was explaining that people who have experienced TBI and have lost their mobility, as soon as they have some level of independence, they get discharged. But that person might still want to learn to run again. That person might still want to learn to walk with a different level of ability again. That person might want to learn to pick up groceries off the ground and put them on the counter, And I just hearing you speak about the difficulties that you faced while your medical team identified them as mild or whatever descriptive word you want to use, they were still really significant to you.
Yeah, it was life-changing for me, for sure. And certainly, like as you mentioned before, planning a wedding in this young stage of my life, and it just, everything got so much harder for a long time. And I ended up making a career decision to leave that busy practice for a quieter, slower pace. And so I started my own practice.
For those of us who can't see us, we're all laughing because I think everyone knows owning and running a business is not necessarily slow pace.
Yeah, my grew very quickly too. I mean, this was a few years out. So I started my practice in 2016. My surgery was in 2013. Maybe it's not that much time in between, but it wasn't originally started with the intention of a slower pace of life. But I think what I realized more was that patient care focus. And that's why I set out for this. And that's been one of our driving forces is, can we make a difference in our community by providing more comprehensive patient-centered care, really getting to know our patients and their families beyond just what the standardized scores tell us. Because that's what I feel like was maybe missed in my case.
I love that so much. I wonder if you could, so we've gone over your acute period. So you experienced your TBI, you recovered in those first 4 to 6 weeks. Sounds like there was a slow transition through that first year until you really felt like things were, quote, back to work, as you said, for you. What happened after that? How has the long-term, what's your long-term healing process been like?
It's really nice to think about this because I've just accepted it, right? And it's hard to understand. I think I still have a lot of the deficits that I say. My language formulation is certainly not what it used to be. And I have these paraphasias still all the time. And most people don't know about my brain injury. So here I am as this educated speech pathologist who owns my own business. I'm CEO, who says these words that just don't make sense. Like I'll just insert, or like I'll use the person's name, like the wrong name. I've referred to my own children with the wrong name, and not like recently I referred to my child as my friend's kid. Like I know my little girl's name. I can't handwrite anymore ever since my surgery, and they haven't been able to explain this to me. When I am writing by hand, I insert letters incorrectly. So I might be spelling something as simple as, maybe not my name, but I might be writing a word school. And if I'm thinking of the next word, I'll put a letter where it doesn't belong. So if I'm thinking ahead, I'll insert letters incorrectly. If I'm thinking school day, I might put a D in the word school somewhere. Only when I handwrite, not when I type.
That was going to be my next question does that happen when you type?
No. So I can't provide handwritten notes to my families because I look like I have spelling errors everywhere because I have to cross out my letters. Isn't that really strange?
Wow. It's a very interesting intersection of executive functioning, motor connection, phonology, probably. I don't know. That's a lot of things. I'm going to stop talking because I'm going to describe it poorly.
I'm sure there's therapists that'll have a field day over that one.
Oh my goodness gracious. So the point, I guess the takeaway here is, even if, as your neurologist said, you're fine, even when a lot of indicators are positive, there are still lasting effects that you experience that you have successfully navigated around. But it's important to take that into consideration it's important for the professional to take that into consideration.
Yeah, I mean, there's still a lot. There's, big, like decision making still really challenging for me. Emotional regulation. And it's funny, people recently have described me as a really calm presence. And like, I've worked so hard on that because internally, like with that frontal lobe injury that I have, my emotional regulation, it requires a lot of work to stay calm and steady. There's just a lot of things. And then as a busy mom of 2 kids and a working professional, as a business owner, there's a lot of these skills that I can't help but wonder, had I not had this brain injury or had I had some more therapy afterwards, would I still be struggling through them, or would I have to put all this extra effort into kind of running a company that requires a lot as it is? And am I faced with this additional hardship? Possibly.
I wonder, you talk about how you've had to put a lot of work in with your emotional regulation and all of these pieces. And are you just seeking all of that out yourself? You're using your expertise just as somebody in an allied health field to kind of make that determination around what would be a better fit for you to help support you on this journey?
Yeah, it's been all self-study. And I think that says something because I am aware and I'm able to access the resources. But most of our patients don't have a background in this, right? They have completely different skill sets, and they wouldn't necessarily have those same tools and resources that I've had to seek out, or they wouldn't even have that awareness necessarily.
Yeah, I mean, I'm just thinking even your ability to identify, okay, I had a frontal lobe injury, which is going to affect my ability to regulate my emotions and respond to this type of stress. These are things I need to be able to do because I'm a mom, I'm a business owner, I'm all of these things. And I just think about how many people who must be in your same position where somebody determined that they were fine, they were good enough, but they don't know even where to go to start looking for this. Maybe all they know is like, I'm feeling really angry. Well, that doesn't help connect you with a solution that's going to help you like move forward on your healing journey. So that, yeah, I think that's a big missed area right there.
And that I was gonna say something exactly in that same vein, is that it's making me think of this intersection between the healing journey, but also the limitations of our infrastructure. So as SLPs, as any clinician, what threshold of eligibility do you have to prove to get services covered? To your point, you're a private practice owner, I'm a private practice owner, we understand the limitations of billing and submitting for funding for the work that we do. And to your point, when you reflected on it and said, what would have happened if you had gotten therapy, just the limitations of our infrastructure to provide therapy for those who might, quote, don't meet that threshold, even though they've identified areas of need. And what SLPs can do to advocate in those instances for our patients to either get funding or create documentation that better supports funding, based on the assessment measures they did by focusing on patient-centered care.
I mean, I think even more broadly, and I won't go too hard on my soapbox here, but I do think it's sort of a uniquely third payer party centered healthcare problem. So that's another piece too, is just thinking about all of the barriers that our healthcare system puts in place to kind of gatekeep services for people based upon their unique insurance plan or what they have access to. So those are also things to think about. Much bigger infrastructure.
I'm wondering what you can tell us about what you wish SLPs, having had this experience personally, what would you say you would want SLPs to know about treating individuals with brain injury across any phase of their recovery?
I think the greatest thing we can do as therapists is really listen. As speech pathologists, we do a lot of talking, right? We do a lot of talking to fill the room and make everybody feel comfortable and show that we know our stuff. But I think we have to really listen and read between the lines and really get to know our patients and how things are going. I think as therapists, we need to put more emphasis on the counseling side of our educations. I think there should definitely be more work done so that we know how to ask the right questions and really understand how our patients are functioning and how they are perceiving their own journey. And so I think if I could leave everyone with one really strong message, that would be it for me.
I'm just going to go ahead and speak for both of us. We totally agree. I think that aspects of counseling touch so many aspects of our field. And most of us don't get explicit training in counseling. I'm also going to sort of in a similar vein, thinking about the person-centered care and the counseling aspects. This goes back to something else that we've talked about briefly, is the idea of a comprehensive assessment. So comprehensive assessment techniques can involve a lot of listening, a lot of interviews, a lot of collecting the evidence that is rooted in a person's experience instead of just the scores on a test. that is, again, I know I've said it once already, but that is the evidence that we might need. And you can infuse counseling into those aspects to better support someone in the longer journey in terms of thinking about how they could be best supported to reach how they define their long-term goals.
Mm,
It's
absolutely.
it's very important. We did have the pleasure of interviewing, for those who are listening, we did have the pleasure of interviewing Dr. David Luderman on the importance of counseling in communication sciences and disorders. And it's free. It's listed on our YouTube channel. I was there for the interview and I've listened to it like 5 times after that. The man changed my life. If you're listening, Dr. Luderman, which I'm sure you're not, thank you so much for sharing all of that with us. But yes, I just second all of those thoughts about counseling and how important that is in all of this.
As somebody with the lived experience of having a brain injury, are there any important pieces that you would wish providers or even other communication partners would understand about what that experience has been like for you?
Yeah, I think there's actually a lot. It's funny, there's so many deficits. There's so many things that are challenging for me now that I'll mention or I'll try to speak about. And I get such quick responses. Oh, that happens to everybody. So, everyone is forgetful or they feel like they get scattered or they get overwhelmed easily. And it's actually, I wasn't like this before. It wasn't to this magnitude before. And it's challenging when it is just dismissed as, but look what you've done. Look what you have accomplished. Look at where you are. And like everybody gets overwhelmed or everybody, all of these things. But, I could be together. We can all be having dinner and I'm having a conversation with the two of you. If I try even for a moment to listen to the conversation of the person who's sitting right next to me, I shut down. I can't do them both. And what that looks like then to the people I'm speaking to. Or if I'm in a professional setting and I'm taking notes and someone asks me a question, I cannot shift back to them because I did not take in even a word that they had said. And yes, it's hard for all of us. These are things that are, I think, characteristic of us, but this impacts my every single day. It impacts my professional image. And so I think it's really important that we all recognize that there's so much happening beneath the surface. There are so many challenges that we are all working through, and we can never understand them all, really. And for what our providers to really, again, listen and understand and kind of dive into and spend some time on, I think would be really beneficial.
I also think based on, the story that you're telling, it's really important to remember that your lived experience is different than someone else's lived experience. So you can never truly know what it is like to be in someone else's skin, how they are experiencing sensory information, how they are experiencing life. And as Amy said earlier today, when you're treating a person, you're treating them with, what did you say? All their human parts, all of their personness. So that person is a wife or a husband or a daughter or someone who is a student. I mean, with kids, without kids, lover of dogs, loves to ice skate. I mean, people are multifaceted and multidimensional. And when you have an injury like a TBI that affects so many aspects based on the story that you're telling, it touches everything you do, as you said. So taking a look and actively listening and not making assumptions about someone else's experience or dismissing their experience is so important. And I feel like as a clinician, if you do bring that bias to the table, if you do bring that assumption to the table, you're going to miss really important pieces of clinical evidence to help you in your job. You will prevent that person from sharing things with you. You will prevent your client from trusting you to explain that it's really difficult to do certain things because, everybody else says, it's no big deal. Oh, you're fine.
Absolutely. So perfectly said. Yeah. It's it's really comforting to hear all of this now. I'll have to tell you that.
Oh,
It's the acknowledgement that
glad.
maybe I was waiting 9 years for that.
Well, I'm glad we were able to do that for you. It's not really the point, but that's a nice benefit, I guess.
But if therapists are passing that message along to their patients, right?
Yeah.
That's what it is.
Yeah,
If they
that's
can
what
have that
matters.
conversation, if they could have taken those notes and
Right.
And it shouldn't have
taken a
taken
version.
9 years for someone to have that conversation with you.
Right.
And I think, it's still, I know I've said this a couple of times. I think to me, it comes back to when we're doing our client interviews and having that interview process happen on an ongoing basis and really thinking about the questions that we're asking and the way that we're asking those questions. So that, because I could frame a question about going out to eat and switching attention and how that experience is for you in a way that makes it more likely you're going to share your actual challenges and describe those for me. And through that, I'll know more about also how it seems like emotionally you might be feeling about that, rather than, having you just check a box and having me look and say, oh, it looks like sometimes, switching between conversations is hard. So I think that's also a takeaway clinically for me, is to really try and be thoughtful about what questions we're asking and how we're opening the door to those conversations with our clients.
So to recap, in terms of our listeners who, and in thinking about our third learning objective and how we can better support patients and families who are recovering and healing from a TBI, the importance of not only actively doing some actively listening, you get my point, purposefully engaging in active listening, purposefully infusing person-centered care and active listening through a comprehensive assessment to really let the patient drive some of the treatment outcomes, but also advocacy, making sure that there are additional transitional supports in place, making sure that all of those components of the healing process, the physical, the psychological, the emotional, all of those are addressed, and the whole person is in the center of all of your treatment. It did make me just think of a question. What were the helpful components of the support that you received? What was really positive? What was a positive impact for you across those different domains?
What was a really interesting one? Exercise. Exercise was one of the things that helped me the most, especially when I was having cognitive fatigue and I had never been a runner before, but I suddenly got into running and I found it really helped. So a therapist had recommended that to me, or maybe it was a friend of mine had recommended trying it. And that was a really helpful strategy that I had never thought of on my own.
Interesting. And again, I'm thinking back to a conversation we had, Amy, for those of you who aren't watching, Amy's nodding up and down. She knows what I'm about to say. We did an episode with Jenna Marie Rosenthal that I've already mentioned about recovery and the connection between fitness and movement and neurological recovery. And there is a lot of neuroscience about the brain plasticity and movement and neurology. So that makes a lot of sense. Well, we so appreciate you joining us today. We're so grateful for your time. Is there anything else that you would like to leave us with? Any words of wisdom for all the SLPs out there listening who want to learn more about supporting patients and families with brain injury?
Yeah, this has been such a great experience. Thank you. I think if the biggest thing is looking beyond the surface, right? There's so much of that in our culture right now of things look so perfect and like that we have it all under control. I shared this with them before. I'm in this like fairly professional looking room, and right below my camera is my kid's train table full of 100 different toys. There's so much going on. I looked like I had a therapist. That pediatric therapist was pretty good at her job, and I did a great job in front of my patients. But then beneath the surface, I was recovering from a brain injury. And so I was able to sometimes, I think, fool some of my physicians or some of the people who are evaluating me. And so looking beneath the surface and really understanding that full picture of the patient and all of their ever-changing needs, right? Meeting them where they are, but looking for their future too. I would have never in my wildest dreams thought I'd be starting a business, but here I am. I run a company of 14 people and I change our community. And I have a really important, very privileged role in doing so. But so if, maybe if therapists had looked at me a little differently, who knows, right? So thank you so much.
Perspective. I absolutely love that perspective. And I have just one more thing to add. And I know we were just going to wrap up, but I promise it will be short. The importance of being vulnerable and open with our clients to create an atmosphere of trust. So when you said you were putting on a brave face and sort of fooling some of your physicians, I think that there is a lot of vulnerability that goes into not only asking for help, but talking about, this isn't going well for me. This is painful. I'm having a hard time. And it's really hard to do that in a therapeutic environment if the therapist working with you isn't also creating space of safety for you to have those vulnerable moments. So if you are an SLP or other professional listening and you have an opportunity to support patients and families recovering from and healing from a TBI, not only keeping that person in the center of your clinical decision-making, but creating safe spaces to share that vulnerability and allow them to let you look beneath the surface. Because at the end of the day, that is something that the patient needs to choose to do. And it's a privilege to help someone and support them in that role. Mm-hmm. And that's all I'll say. Thank you so much for joining us. This was really wonderful, and we so appreciate having you. And we hope everyone enjoyed everything today. Thanks so much, Christy.
Thank you so much.
Thank you.
Thank you again, everyone, so much for joining us today. We are so grateful that we had the opportunity to have Christy O'Donovan join us. Again, we really encourage all of our listeners to spend the time, listen to the stories of the patients and families that you work with. Continue to refocus your lens on person-centered, client-centered, patient-centered care. Make sure you remember that patient-centered care and client perspectives and values are part of our evidence-based practice triangle. And we have so much to learn from the stories and experiences of the people that we serve. A big thank you again to Christy O'Donovan for joining us today and sharing her story. We learned so much from her. We always learn so much from all of our guests. If you have any questions about anything that we covered today, please don't ever hesitate to reach out to us. You can reach us at info@slpnerdcast.com. We love hearing from our listeners, and we are so grateful that you've joined us today for this episode. Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.